Aloha, everybody. Hope everybody had a great lunch and you guys are re-energized for the afternoon sessions. This is the second session of the geriatric track, Lessons Learned, How Community-Based Organizations and Coalitions Supported our Kupuna during the COVID-19 pandemic. Before we get started, I just wanted to say mahalo to all of you for joining us today in this session and allowing us to share some of our manalo with you. A special shout out to all of our CBOs in the room. Really, you folks are the thread which binds our communities together, and you weave together a safety net for all of our kupuna so that nobody falls through the cracks or is left behind. So I just wanted to say thank you to all of you. Okay, some of the goals for today's presentation includes recognizing the value of community power and the integral role of community-based organizations, or CBOs for shorts, in meeting community need, learning about the vulnerabilities of kupuna during public health emergencies while continuing to honor their contributions to our community and also celebrate their leadership throughout the COVID-19 pandemic, learn about how coalitions and CBOs are essential for equitable and inclusive emergency response, and finally, exploring how health systems and CBOs can work together and leverage their strengths and assets for more effective response to address ongoing and future public health concerns. My name is Lindsey Ilagan. My pronouns are she, her. I'm the Kupuna Program Manager at the Hawaii Public Health Institute, or HiFi for short. In partnership with the University of Hawaii Center on Aging and with support from the City and County of Honolulu Elderly Affairs Division, I'm also the co-coordinator for the Kupuna Collective, a social incubator for aging impacts. The Kupuna Collective envisions all generations in Hawaii thriving in a vibrant, age-empowered society that maximizes 1, the health, 2, independence, and 3, engagement of Kupuna. And we do this by bringing together a collaborative network of partners who elevate critical issues, mobilize community assets, and also drive innovative solutions forward to support and empower Hawaii's older adults. I'm honored to be your moderator for today. And I'll try my best to set the table for a more in-depth presentation from my fellow speakers here about the value of CBOs and coalitions for Kupuna health. So before we get started, I think it's important to know kind of the profile or a little bit more about what our Kupuna population looks like across the state. So just real briefly, 1 in 4 Hawaii residents are 60 years or better. And that number continues to grow. I think all of you folks here are interested in Kupuna and kind of know what our communities look like. But Hawaii is one of the most rapid aging populations in the nation. In the last 10 years, we've seen a 20% increase in our Kupuna population while all other age groups shrank. Additionally, 57,000 Kupuna, or about 19%, live alone. Over 80% of Kupuna have at least 1 chronic disease, with 77% having 2 or more chronic conditions. 43% of our Kupuna live in or right at the cusp of poverty and struggle to make ends meet. Over a third of our Kupuna live with a disability. And over 35,000 Kupuna have limited or no access to the internet, landing them on the wrong side of the digital divide. Then in early 2020, COVID hit. So I just wanted to take a pause and briefly recall a time back about 2 years ago. The first documented case of COVID-19 in Hawaii was on March 6, 2020, as you recall. The affected individual was the passenger on a cruise ship that had 21 confirmed cases of COVID-19 and became ill after returning home to Oahu. By March 19, 2020, the Hawaii State Department of Health reported 26 positive cases statewide, and county-level mandates to curb the spread of COVID-19 were implemented by March 20th. This included the closure of indoor restaurants, parks, nightclubs, non-essential businesses, the implementation of a nighttime curfew in some counties, and limits on group gatherings. This also included the closure of places like senior centers, adult daycare sites, congregate dining sites, and other trusted community spaces where Kupuna gather, participate in programs, and access important information and services. These measures were then followed up by subsequent travel restrictions, quarantine and testing protocols, and shelter-in-place and stay-at-home orders. And you recall at this time that many people without that digital access became extremely isolated, and it was not uncommon to find grocery stores' shelves empty. Instantly, our Kupuna and many others became homebound without adequate support to meet their basic needs. By March 31st, Hawaii saw its first COVID-19 death of Kupuna. Community partners quickly mobilized to leverage collective resources and connect Hawaii families with the support they needed through these critical times. Of notable mention was the formation of the Kupuna Food Security Coalition, spearheaded by the EAD, AARP Hawai'i, Aloha United Way, Weinberg Foundation, and many other partners to connect Kupuna with food and meals and wraparound health and social support. Then finally, in December 2020, emergency use authorization by the US Food and Drug Administration was granted for the first COVID-19 vaccine for use by adults 18 and over. By this time, there are 18,951 cumulative COVID-19 cases across the states. While COVID-19 affected everyone's lives, there were a few more severely impacted than our Kupuna, or older adults, who experienced the highest rates of serious illness and death related to COVID-19. DOH sought to address the vulnerability of our Kupuna by prioritizing vaccine access, largely based on an eligibility system on risk and age. Availability of COVID-19 vaccines increased over time as manufacturing ramps up and additional vaccines gained EUA status, and more providers offered the vaccine in a number of settings. So at this time, if you recall as well, community partners, government agencies, and others stood up emergency relief and mass care services to meet the growing needs of our communities, including large food distribution events and mass vaccination sites like you see in these photos. While many Kupuna were able to access these services and successfully get vaccinated once eligible, many others experienced challenges and that delayed or prevented access altogether. We learned quickly that what worked for the masses did not necessarily work for all, and that these mass care services could even exacerbate disparities between groups and exclude those who are already underserved by our existing policies and systems. There were many challenges and barriers that prevented or delayed vaccination or access to other essential services, and some of them are listed here. It's not an exhaustive list, and I won't read through all of them, but a few examples. There are limited options for those who are homebound. There are limited options for those that needed additional assistance on site, requiring mobility aids or screen reader technology or other assistive tools. There was limited access to information that was culturally appropriate or in alignment with community values or in the appropriate language, and so on. These barriers were complex and could not be generalized across communities and subgroups. But the compounding effect, however, for Kupuna already marginalized by race, ethnicity, disability, geographic location, language proficiency, socioeconomic status, limited mobility or cognitive functioning, and homebound status was considerable and required a multi-approach to ensure an effective and appropriate response to limited vaccine access. As the landscape of COVID-19 vaccination evolved, multi-generational approaches and strategies to improve the capacity of our wonderful communities to respond were implemented. Despite, however, the growing availability of vaccines and other essential support, COVID-19 continued to devastate Hawaii's communities as certain subgroups continue to carry a disproportionate burden of COVID-19 impact, including Filipinos, Kanaka Oiwi, Pacific Islanders, and those with other barriers preventing or delaying access to services. And yet, despite the barriers, our CBOs were committed to working every day to ensure that our Kupuna, as the backbone of our communities, were supported and had access to vaccination and other essential services that were inclusive and responsive to their needs. CBOs set the blueprint for how to work across organizational and sector boundaries in service of our larger kaiāulu, to mobilize resources and activate partnerships quickly and effectively, and in more than just a symbolic way, empower our Kupuna with the resources and support they needed to achieve their best health. Quick mobilization of our CBOs resulted in over 1 million meals and food boxes distributed to our Kupuna, over 30,000 wraparound health and social services delivered, over 8,000 unique Kupuna served weekly, and over 4,000 kupuna linked with long-term support. And that's just what we have in our data. We know that so much more community work was going on behind the scenes that never made it into our data analysis. And then this is just a quick visual of some of our community partners who work to address kupuna food insecurity, many of whom became a lifeline for kupuna across the state. Rain or shine, the meals were prepared and delivered to kupuna at their homes. And for some kupuna, this would be their only reliable meal or social interaction for the day. With help from the University of Hawaii, we were able to track some of the changes short-term in kupuna food security. So you can see even just at a quick glance, the difference between March 2020 on the top row and September 2020, 6 months later on the bottom row. And that's the number in percent of seniors served. Coalitions, like the Kupuna Vaccination Outreach Group and many others, engage with thousands of kupuna to answer their questions and address their concerns, help them with registration and appointment scheduling, provided transportation to and from vaccination sites, translated materials and offered on-site interpretation, and brought the vaccine to them, whether it was at senior centers, adult daycare sites, senior housing, places of worship, and at their homes. As a result, 100.0% of our kupuna aged 65 or better on Oahu completed their initial vaccination series with similar rates on neighbor islands. Our CBOs were exemplary community servants and worked together to create a safer Hawaii for kupuna, but also people of all ages, regardless of their geographic location, language spoken, or homebound status. So, without further ado, I have the privilege of introducing two of those outstanding community servants today. First, we have Dr. Dela Cruz. She is a director of health equity and research at the Hawaii Public Health Institute and an assistant researcher at the University of Hawaii Office of Public Health Studies in the Thompson School of Social Work and Public Health. Her previous roles were at Imihale Native Hawaiian Cancer Network, a program of Papaola Lokahi, and the UH Cancer Center. Dr. Dela Cruz's current research involves underage drinking prevention, reducing health disparities among Filipinos, and increasing COVID-19 vaccination and outreach to Hawaii's most vulnerable communities. She received her bachelor's degree in psychology and master and doctoral degrees in public health from the University of Hawaii. Next, we have Dr. Nicole Mahalani Lam, who was raised in Aiel, Oahu, and practices primary care, family medicine, and geriatrics at Kilimamo Native Hawaiian Health System. She is a scholar of Papaola Lokahi's Native Hawaiian Health Scholarship Program and serves on the board of directors for Ahanui o Na Kauka, the Association of Native Hawaiian Physicians. Dr. Lam provides community education and medical home visits to Kupuna in collaboration with Kula no na Poe Hawaii o Papakolea Kewalo Kalavahine. In her spare time, Dr. Lam enjoys studying hula and oli, making lei, learning lomi lomi, and helping her ohana lead aina restoration efforts at local I'a Pa'ayao Fish Pond and Kamahi'ai Ihi o Wailea Maile Farm. I'll go ahead and pass it to you, Mary Rose.
Mahalo, Lindsey, and mahalo to all of you for attending our session and to AHEC for inviting me today. Like Lindsey said, I wear multiple hats. I'm with Hi-Fi, but also I'm at the University of Hawaii, but I'm also the Philcom Cares co-founder, and I'll be talking a little bit more about that project we started. But before I start, I do want to acknowledge, do a land acknowledgement. I have ancestral ties to Lumba Dingras Ilocos Norte and also to Carmen Bohol, Philippines. I am a settler here in the Kingdom of Hawaii, which is for the Kanaka only. So I just wanted to, I think Lindsey did a fabulous job going over COVID-19 in Hawaii, but I also wanted to highlight community-based organizations that helped different populations and communities. So before the pandemic, of course, the Native Hawaiian, Pacific Islanders, and Filipinos were disproportionately affected, and even more so when the pandemic started. So these populations or communities have had the highest rates of COVID cases, mortality, and hospitalizations. And you saw that in the headlines. You saw it day in, day out with Native Hawaiians, Pacific Islanders, and even Filipinos. And you saw that in the data. So this is actually from this week. And I'm a researcher, so I'm like, you have to show your data, May Rose. So here's the data, and the data doesn't lie, right? But there's more to data. There's stories, there are people. So what I want to show here, amidst the badness of the data, but you see here the Native Hawaiian, Pacific Islanders, and Filipinos, the cases are pretty high, and Filipinos are always number 2 or number 3 in the cases, and that's what you see in the red boxes. But as a Filipina, this affected me greatly. So Filipinos were always number 1 in mortality rates for COVID-19. So when you talk about how the pandemic affected Filipinos, when you look at the pre-COVID disparities, we live in multi-generational homes, we have congregated dwellings, we're essential workers in tourism, retail, food, and then we're frontline workers, nurses, doctors. We have care homes. We do have high rates of obesity, hypertension, diabetes, asthma, and then we have limited access to healthcare. And a lot of it is language and transportation. The number 1 consumer of the bus are Filipinos. There's financial hardship. The reason why there's like 20 of us in a home is because we have to pull together for rent. We have to pull together for our food. And then we were deeply and traumatized by colonization and militarization. And many of us, just like myself, were not English speakers. English is my 4th language. So imagine that, trying to get access to healthcare when English is not your first language. The picture you see here is my dad. He was recruited, and he was a plantation worker. So I have deep-rooted history and feelings for the immigrant populations. So when the pandemic started, you see a different focus on Filipinos, like frontline workers who are getting burned out. The pandemic hit Filipinos hard. And then, so like Lindsey said, it started hitting Hawaii in March 2020. And so we waited. Unlike Pacific Islanders and Native Hawaiians, Filipinos don't have a centralized health organization. We don't have a papalakahi, we don't have a OHA here. So a lot of us were waiting for the government to come to us and say like, hey, Filipinos, you are number 1 in death rates. But no one came. So what doctors Amy Agbayani, myself, and Dr. Agnes Malati did in our spare time when CJ was speaking the first session, like everybody was volunteering, and we felt like we had to do something as scholars and advocacy individuals in our communities. So we came together and got other volunteers, and we formed Philcom Cares Project. And it's born from the pandemic, but it is our response to it also. And we started off with 20 volunteers, and we started off with Catholic churches. 90% of Catholics in Hawaii are Filipino. So we started getting funding. So that's why you have the CARES part of Philcom Cares. We got CARES funding, and we started looking for people, looking for volunteers, speaking our language. We started off with COVID tests. So that's what we started off here when you see the picture at the Philcom Center, and that's with Waihawa Health. And we partnered a lot with our FQHCs and other CBOs or community-based organizations. And with that, within 2 years, my night job was to be the grant writer, and I helped leverage $850,000 for Philcom Cares. And we did 100 vaccination clinics statewide. Currently, we're at our 5th radiothon, and we translated materials. So we got it from the Department of Health, but of course, you all seen the Department of Health materials. It's very texty. So what we did was we translated in Ilocano and Tagalog, and we took the top 5 things the take-home messages from that, and we made sure that Filipinos understood it and it was consumable and understandable. And we did that in social media. We put pictures of us on the messages, and we started having volunteers come in, and that's what you see here, pictures at vaccination clinics. But one of the main concerns when we started doing the vaccination clinics was I had a Nana tell me, like, I have so many questions about the shot, but it's hard because I don't know what I'm reading. So a lot of the materials were still being written and said in English. So, being a Filipino, it's hard because we're so far away from our homeland. So I always say, if you want to reach Filipinos, you send Filipinos. And that, because that we feel a strong connection to our fellow kababayan, that we feel safe at home with them. They speak our language. You don't really have to train a Filipino provider or community worker because they know the language, they know the culture. So what you see here is on the left-hand side, we started doing the radio airways. We do radio stations. We do, I think, every Monday at KNDI for half an hour since been doing this for over a year and a half. We tackle misinformation in Tagalog and in Ilocano and in English, because there's a lot of misinformation and Filipinos love listening to music. So we talk over at KNDI. Radiothons are our favorite things. We speak for 3 hours. We have entertainers. We gave away lechon, which is awesome and yummy. But we try to, this is what reaches Filipinos. Sometimes newspaper articles don't reach, sometimes TV commercials don't reach us. Radios will reach Filipinos. And whenever you did a vaccination clinic, you are welcomed by Filipinos. So if you find out you're Visayan, we have a Visayan provider there or an Ilocano provider, and then they sit with you. And we know the internet is hard and there's trust issues. So actually after mass, we usually sit outside and we register our nanas and tatas one by one, sit down question by question and register them. So the next Sunday when they come for mass, we vaccinate them. So what you see here is also the social media that we translated ourselves. Oops. So it's not just the Filipinos, it's the Marshallese and the Chickees, the Samoans, that community outreach mobilization. We were doing the work that the government wasn't providing for our communities. So we saw that, and we did it ourselves, but it's very siloed, and we did it with minimal money. So down the road, I'm going to talk about funding, how that helps a lot. But I just wanted to share this quote by my manang, Amy Agbayani. She said, the COVID-19 problem just amplified the inequalities. The takeaway is that the government and private groups have a responsibility to work in partnership with these communities, because these communities are here and deserve support. And because with that, and CJ, he generously and graciously kind of uplifted what I was going to talk about, but I wanted to talk about his project. So he was working for the Department of Health, and he had a COFI grant called Community Outreach Public Health Education. And we started off that way, along with the CARES funding. Philcom CARES got some of his funding, and it was like $50,000 that we had to do in 3 months. And that's the thing with money. Money's not really free. You have to hustle, and not only you have volunteers, but somebody has to do the work. So I wasn't paid, Dr. Amy Agbayani wasn't paid, and Dr. Agnes Malati we weren't all getting paid, even our volunteers, but we had to do it. We had to get our vaccination clinics going. So we had to do paid advertisement. We had to have incentives. We had to buy lechon, right? So thankfully there was a new grant by CDC given to the Department of Health, and Hawaii Public Health Institute is the leader of that grant. And we started giving out money, not giving out money, that sounds like not money's not free, right? But having this RFP, request for proposals, for existing community-based organizations. Like I said, the Marshallese Community Organization, we are Oceana, and we said we want to fund what you're already doing outreach. No research is out, you support your outreach work. So we started doing that March 20, and it ends November 30, 2022. That's what CJ was talking about. They give you a bunch of money, but they're like, do it in a small, short amount of time. But within that, the first month, we got 11 community-based organizations, and we have 7 federally qualified health centers, and we're doing it statewide. So it's a 3-pronged approach. We have CBOs, FQHCs, and then we also do the translations part for the Department of Health. So this is a very different mechanism or funding because it's purely outreach. So with our community-based organizations, it's not a cookie cutter funding, right? We just say, Philcom cares, you do radiothons, we'll fund that. We are Oceana, we'll fund all the outreach that you're doing, like the Island Hopper series for your Facebook Live. We have Care Suite, it's a call center that has all these interpreters. When we give out our number for Philcom Cares for Vaccination, we give them Care Suite's number, and then Ilocano will answer the phone. Ilocano will call you up and tell you need a follow-up booster now. So it's these special services that we're funding. And then you can do, no, I don't want to say you can do whatever you want with that, but we do have, it's really designed for the community. So we are Oceana, or MCO, the Marshallese Community Organization of Hawaii. They love sports activities. So they have basketball tournaments, they're wearing their masks, but they also have vaccination on the side. And what you see in the bottom pictures, they had this Lauhala hat making race, but they also provided food and whatnot, and we could help support that. So we're meeting the community where they're at, where they are. We're just funding them, but we're also supporting them. On top of that, we also do technical assistance. We've had 5 training how to write a grant, what are the most important things to know about COVID, messaging, social media. So these are wonderful CBOs, and I'll show you a better picture. And our FQHCs, we are so thankful for them. They've been so busy. They've been doing the great work of being our COVID messengers and vaccinators and providers. We do have Healthy Mothers, Healthy Babies. We have Project Vision, so mobile clinics that are going out. So we cover statewide and county. What you see is the different organizations there. So the Brada is all him. Sometimes you have a food festival. He is there on the mic, not only entertaining Tony Silva, but he's also telling you about COVID tests. That's purely intentional, on top of playing Hawaiian music, and we have KEO, it's Kauai Economic Opportunities. They serve the unsheltered populations in Kauai. And we have the Big Island, we have East Hawaii IPA, and they're just Big Island doctors going home to home or having vaccination at their clinics. So we want to have a long rural reach instead of just being Oahu centric. So I think there was a question in the first session, like, how do you collect data? And whatever I do, I'm a researcher, right? So I'm like, data, you can put data in everything, collect them all, and then also, but tell the story. But we do have, from all this is until June, and mind you, we only started in March. We've had 916 community events. We distribute 25,000 tests, and we've done 15 radio broadcasts and 8 virtual events. And we also translate numerous materials made for different communities. And we do want desired outcomes. And I think CJ and Lindsey went over that, like, it's hard because they're leaning a lot on community-based organizations for vaccination and testing, but we want to be utilized that way. But at the same time, there has to be a sustainability plan. We can't be the end all be all. If there's another pandemic, if there's another disaster, you can't just throw it at the community-based organization to solve. There has to be some infrastructure and funding to it. And we have to be at the table all the time, and we have to fight for that and not just be like a second thought, like, oh, let's ask so-and-so. We should be there from the very get-go. But we do want to have also the big F word, right? The funding utilized for communities, made just for the communities, no extra ties. Don't just add like, you're going to do this, but you're going to collect data for us, or you're going to do this and you have to run a webinar or stuff like, or go to a conference for us. Communities are doing so much. CBs are doing so much. Just give us the money and let us do the work that we're doing, and we're going to show you how. Sustainability, supporting infrastructure, bring us to the table. We don't do a lot of policy work with communities. I wonder why, right? So bring us when you're making policies. It's really important. And normalizing translational services. I'm a big advocate for this. If you're going to have a website, put Tagalog, English, Chinese, everything on there. It's not hard, but there should be equity in the information that's being disseminated. And data disaggregation. What I showed you in the beginning with the bar graph, data is being disaggregated, sure, awesome. But for Filipinos, we're still invisible and being put into Asian. We're doing so much vaccination clinics and efforts, but they didn't tease out Filipinos from Asians, which is really weird. So how do we know that all the stuff we're doing is actually working? So I've been asking, if you folks can help me, but asking them to disaggregate the Filipino from Asians to really see if our work is being represented well. And that is it for me. Thank you. Mahalo. Salamat agyamanat. Oh, sorry, can I have one more thing? Sorry. Yep. I just remembered there was a question in the first session about partnership. How do you partner with CBOs? I love this question. And I think when we were eating lunch, we were talking about Ponoshim. And Pono, I took a workshop from him, and the best thing, one of the best advice I got was from him. And he said, how could you, I even wrote it down. You can't get more information, or you can't get more if your vessel is full. So come with an empty vessel. And that is my piece of advice. So if you are wanting to partner with CBOs, show up, listen, don't come like, I heard about your webinar and I know this, I have like 500 degrees. No, that doesn't work. Sit down, come early, put in the work, identify yourself, help clean up. Next time, show up, do the same thing. And we'll see that as a CBO. We see that you're committed, but don't only come for the good food, come when there's a cleanup in our community, come when there's a town hall meeting. If there's sign waving, pick up a sign, be in the neighborhood, be part of that community. And then you'll understand why, how you could lend your voice in that community. Because there's so many voices. We don't need your help. Come on. We're so already abundant with help and support and strength. You have to make yourself be like outstanding for us to accept you in our community, so really work for that. It's not like, we really don't like handoffs anymore. We're a lot more savvy and stronger and smarter than a lot of the funders and government officials think. So come prepare, pretend you're coming to our house, take off your slippers, help us pull weeds, cook our food. So I think that's my advice.
Mahalo, thank you so much, Lindsey and Rose. Can we please give another round of applause for them? It's so beautiful. Mahalo. Good to meet you folks. Thank you so much for being with here. I'm honored to present and just share my story of how our organization and individually as a provider, I've been taking care of my Kupuna patients. So again, I'm Dr. Nicole Mahalani Lam. I'm from Aiea, and I was raised on ancestral lands with my extended family in a kohale style. So in that type of Hawaiian setup, we live kind of like a village where my neighbors are my aunties, uncles, my cousins, my grandparents when they were alive, and my siblings. Very multi-generational, loving, supporting type of structure. And it's because of this upbringing kind of in the community in this way that I was led to the profession of medicine and also to geriatrics. For those of you that were in a previous session of mine, you learned a little bit about my story growing up basically in a nursing home. And I think that was a jump off point, a real great inspiration for how I made it to geriatrics and just my passion for serving our Kupuna and taking care of my patients in the same way that my father, my grandparents were taken care of by wonderful healthcare providers. Where I am now today, I'm working at Kilimamo, Native Hawaiian Health System of Oahu. And just a little bit about this organization. It was birthed from the Native Hawaiian Healthcare Improvement Act of 1988 as a response to the decimation of the Native Hawaiian population. Native Hawaiians, once a thriving community, now suffered from diseases from out of our islands, and with modernization, industrialization, diseases that have persisted. And so this Native Hawaiian Healthcare Improvement Act was to uplift and help our Native Hawaiian folks thrive. And so each system was formed on each of our neighbor islands. We have one here on Oahu, Big Island, Molokai, Kauai, etc. And the point of these Native Hawaiian health systems is to work on the community level to assess what each unique community needs and address their issues in a very specified manner. So not to blanket and give solutions widespread in a general way, but really to address exactly what's happening in each of those separate communities. The mission of Kilimamo is to empower, educate, and promote the health and well-being of our Native Hawaiian community. But I will say that we proudly serve even non-Hawaiian patients and clients. It's just that this is our focus group. So in this story, I will weave through some of the stories and patients that our organization has served, both Hawaiian and non-Native Hawaiian, with a focus on the Kupuna, our older adult population, but also the younger members of the family and how that affected the health of our Kupuna. We'll see. So it's going to be a compilation of photos, as if we're going through a pile of my photos or a photo book, just trying to go through some of the stories surrounding the education and awareness and the actual services that were provided and rendered from our organization. And we'll go through different levels from myself as an individual provider up through the organization and into the communities. So in terms of education and awareness, in terms of providing these to our Kupuna during the pandemic, it ranged from education that was focused primarily on COVID-19, but also on all the other things and complications, consequences that happened during the pandemic as a result of COVID-19 hitting our people. So some of the other things that had happened and what our people needed was education and awareness on chronic disease management, mental health, screening and prevention, and we'll collaborate and weave through these stories how on each of these levels, again, the provider, organization, and community collaborated together to provide it. Starting with the first topic of COVID-19 education and awareness on a personal level, I was very active in doing Ask Kauka workshops with the community. And this is on top of running a primary care clinic and seeing geriatric patients and doing home visits and whatnot. In addition to that, really engaging with the community to provide specific awareness on COVID-19, ranging from 101, the basics of COVID, the pathophysiology of this virus, how it spread, CDC recommendations, and what the protection recommendations were in terms of masking and distancing. Real early on in the pandemic, these were things that we really needed our communities to know, our families to know. It was really interesting that my Kupuna patients were very receptive and accepting of the advice in the media, from their healthcare professionals. I didn't really have to counsel my Kupuna patients that hard about COVID and following restrictions and such. It was the families, the younger adult patients in the homes who might have been resistant to masking, distancing, and eventually vaccinations. And so to protect our Kupuna, a lot of the educational efforts had to be focused on the others in the household. And when I speak of my upbringing, my story of living in Kauhale, that's really how a lot of our patients live as well, in multi-generational homes. So the health of our Kupuna depend on what's going on in the household. So in these Ask Kauka series, joined with other geriatricians, we would talk about these specific consequences of our Kupuna during the pandemic and what everyone needs to do. Aside from education and awareness, specifically on COVID-19, we had to keep treating the chronic illnesses that were happening. Lindsey and Mayrose beautifully showed us that the disparities that existed before COVID-19 were only amplified after the pandemic. And so I've had so many of my patients pass because not of COVID infection, but because of their chronic diseases becoming uncontrolled. Why do I have a 30-year-old with an A1C of 12, with triglycerides to the 2000s, who depends on her 60-year-old mother who has COPD to make her medical appointments for her? Just really terrible, uncontrolled chronic disease for many different reasons during this pandemic, but we see that folks, all young, old, they have passed and they're suffering. And so this initiative to do Ask Kauka workshops, not only on COVID, but on other topics, coronary artery disease, I've done workshops on hypertension, diabetes, you name it, healthy nutrition, physical activity, just to keep our community engaged and informed on all of the different things that can keep them healthy during this pandemic. I do want to give thanks to our community in Papakolea, Kula no na po'i Hawai'i, o Papakolea, Kiwalo, and Kalawahine, for inviting me into their space and trusting me as a provider to provide this educational awareness. Every last Tuesday of the month, they allow me to come and speak with their Kupuna about these various topics. And what's really helpful is they actually assessed their community and they identified the top 10 chronic diseases in their community. And that helps to guide my intervention, how directly and specifically I can address the issues that are going on their level and really address their specific needs. And this is just one of the flyers of KCCN, Kupuna Community Care Network from Hawai'i. Along with chronic disease management, I also talked about aging gracefully. This is the 4Ms framework, and for our geriatric providers, this is what we use as a framework to approach the care of our Kupuna patients in our communities. Mobility, how one moves, how they function independently in the community, mentation, that's cognition, memory, depression, mood disorders, medication, and what matters. It's in this framework that we're able to help our Kupuna patients age gracefully, help to address some of the geriatric syndromes that are very unique as one ages through time. And I had this space to counsel and just bring education and awareness to some of these things to our families so that they can anticipate as their loved one ages through time, what can you expect and how can you best support your Kupuna. I also did workshops on the effect of COVID-19 on mental health, doing some outreach to Hinamauka, substance abuse center, and just talking about the struggles. I've also had many patients struggling with depression, with substance use, and it's not only in our younger patients. I've had patients in their 70s, 60s that are still smoking meth every day because that is life. And we cannot help and solve everything, but for me personally as a provider, the best that I can do is be there for my patients and try to address as best I can the medical things that are going on, counsel on the complications that can happen from that type of substance use, and connect them with services to maybe help them through the difficulties of life, whether that is behavioral health therapy services, substance treatment services, housing. These are all kind of the root cause of what our people are facing. And especially so because of COVID-19, just to tie that connection in. And then the last piece of education and awareness as it relates to COVID-19, not forgetting the screening and prevention that must persist. Going to your doctor to get your checkups, blood pressure screenings to see if you've got diabetes, cancer screenings. This was another workshop that I did with other community members by request of Papaololokahi to talk about the types of screening measures that we should uphold and continue and maintain while we're dealing with all of the other difficulties of COVID-19. Don't forget to do your colonoscopies, mammograms, etc. And as it relates to our Kupuna older adult population, having that goals of care discussion, whether it is appropriate for an individual to continue those kinds of screenings, and just talking about, when we go back to that other slide, what matters in their life, what kinds of care would they want to incorporate into their life in order to thrive and move forward. So as we see with each of these interactions and collaborations with the community, there was involvement on different levels. That's me as the provider, volunteering to step in between my clinic time to do workshops, with the help of the community, with other organizations, and pulling together with other physicians, other healthcare workers to really deliver the education and awareness. And some of these may have been done online, in person, but as it relates to COVID-19 with stay-at-home restrictions, a lot of this was done virtually, and we really relied on the community organizations to provide our older adults with the IT support that was needed for that. And this is just another presentation in collaboration with our registered dietitian as it relates to screening prevention, again, trying to make sure that our communities are still trying to uphold healthy nutrition and physical activity to prevent chronic disease and complications. But what can you do if folks don't have access or the means to implement some of these things that we are educating them on? Lack of access to food, loss of housing, loss of employment. Despite the education and awareness that we can bring regarding COVID and all its complications, sometimes you just need the service too. We also need to connect people to actual support. And we'll see that in the next slide. We'll transition what kind of services we've provided. But as a conclusion for this one, I also just wanted to highlight a collaborative effort with a bunch of providers, Native Hawaiian doctors. This is from a different space that I sit on, Ahahui o Nakauka, the Association of Native Hawaiian Physicians, and how on a larger scale in this community, they had banded together and did a lot of public service announcements, PSAs, to show our Native Hawaiian population that here are trusted Native Hawaiian individuals that are advocating for vaccinations. And it was in this effort that we're able to reach maybe a broader population and inspire those to get vaccinated. So services and support, kind of the same structure that'll continue. We'll have services and support in the realm of COVID-19. And I'll talk about some of these services that we delivered, not specifically for COVID-19, but the type of medical care that we rendered, preventive care, and all of the non-clinical services that are important to one's health, the social determinants of health. So this is me and my medical assistant. We did a pop-up vaccination site, and I know the states and all of our health systems are just doing such great work doing vaccinations. This is a story of just a small clinic trying to do its part. I did vaccinations on the side of the road, Tantalus Drive in Papakolea, to help their community get vaccinated. And while I didn't have the personal infrastructure to do COVID vaccinations, our focus was flu shots, to not forget that other part of preventive care, as everyone is focusing on COVID so much. Just wanted to bring that service to the front line, to the road where our Kupuna live. So we had community members just drive up, we vaccinate them, collaborated with some of the nursing schools so that they could get some of that experience and manpower. For folks, our Kupuna that had mobility issues and couldn't leave the home to drive, we then had another arm of staff. I went into the homes and administered flu vaccines for those that could not leave. Did another pop-up vaccination site in Waimanalo. In that community, their focus is on the houseless individuals. So hui mahi aina, we had collaboration. Many thanks to Auntie Blanche there, who allowed us to come in and vaccinate their residents. Same thing, it was just a pop-up tent and just delivering the care. And we would not have been able to do this if it weren't for the community connection. We were vetted through a trusted Kupuna, individual of this community, and that's really how we're able to service them, this collaboration between the medical side and the community. Again, highlighting Oahu and Makauka. I see some providers here in this room too, Dr. Miriam Chang. Many thanks, she's been out in the community doing vaccinations up in our North Shore, along with our other kauka, individually trying to just pitch in and provide the care on top of our medical care practices. This is Dr. Kupuna Chong Hansen accepting an award from Senator Keoho Kalole, just thanking this group of doctors for coming out. And we're so grateful for this. And really, there are so many organizations and groups out there that are doing such great work and vaccinating our population. And I think there's not enough thanks maybe that goes around to all of the other community-based organizations that are doing the work on the ground. Some of our flyers of the flu shot clinic that we did, and really about the COVID-19 care that we rendered, a little bit about Kilimamo services, in addition to the vaccines and the testing sites that we hosted and sponsored. With the funding, we were also able to provide PPE and testing kits to many of our clients and communities to keep them safe. Preventive care, this is a picture of my clinic staff, my dietitian, registered nurse, my nurse practitioner, who after seeing patients at the clinic, volunteered to go out to a Kupuna gathering, not a li'i convention. And at this gathering, they did blood pressure screening, gave a lot of education on chronic diseases. And it was so appreciated by this group of Kupuna that otherwise may not have gotten their blood pressure checked, may not have sought care. It's really surprising. We've got Kupuna patients at our clinic who are very compliant. They come to their appointments, they take their medications. And on the other side of the spectrum, I've got some Kupuna whom I was called to visit because they haven't seen a doctor in 2 decades and now have end-stage vascular disease with infection, and really calling on me to come into the home and help these families. So being out there in the community, out of the clinic, out of the hospital site, this is how we can reach some of those people that are not coming to us. Just a little bit about the other services of Kilimamo besides the clinic. We do have non-clinical services. We do have Lomi Lomi, branch, dental, and Ho'i Kaika. It's a fitness program. The gym with our fitness instructor, just out of the many things that she does, I chose focusing on the topic of Kupuna. She employed a Kupuna chair program to provide a space and a means for exercise, specifically for our Kupuna. Here's a regimen with a personal trainer where you can maintain your health. And together with the fitness trainer, we also wanted to connect and bring services regarding the other non-clinical aspects of one's health. So providing the food, doing food distribution events. Kilimamo, I didn't mention in the beginning, but we are located throughout the island here in Oahu, not only at Kuakini Medical Plaza where the clinic is, or at our urban site, but also where we have the dense populations of Native Hawaiians. So out in Nanakuli, we have a community site, up in Ko'olauloa, and also out in Waimanalo, Ko'olaupoko. As we went through the pandemic, we saw that the needs of each of these communities is very different. We didn't have the same events at each of these locations, and that just speaks to the need to be unique and very specific about how you address the needs of each community. So while in one community we are doing vaccinations, in another community we're addressing substance, homelessness, and up in the North Shore community, there were many efforts to do food distributions. And it's not a wonder why, it's all the way up there with limited access to many things. And so this was just one way that Kilimamo was able to meet the need of the community. Other distribution fairs that were done on each of the islands. And we came to points where we're giving out food, but going the next step beyond that, how do we help our patients, our communities? It's one thing to talk about healthy foods that you should eat. It's another thing to provide foods to eat. The next level is how does our patient or family prepare this healthy, unusual food for their health. So another layer on top of that is with our expertise of a registered dietitian, actually developing recipes that are culturally appropriate and acceptable to families, using this fresh produce and bringing that to the community in that way. One of the signature events that our dietitian and fitness instructor collaborate on together within our organization is going out to Kupuna centers and doing fitness demos, food demos, just to layer on all of the different preventive strategies for these Kupuna to stay healthy during the pandemic. So coming out to the sites to them. This is a picture of my clinic staff, our dietitian, and our ku'olokane specialist. We were graciously invited to come out to Kako'oiwi Lo'i up on the east side of the island, and it was just an honor to be out there as an adjunct of this idea of bringing food to the community, because that's a great complication and consequence that I think happened of COVID, just a loss of access and a loss of care for oneself. So taking my staff out to the lo'i, we had the experience to harvest the lo'i, kind of work in the way that our kupuna might have when they were younger or back in the day, living off the land. And what they did with that kalo then was bring that down to a kupuna workshop where they pa'iai and then did a food demo and distributed that to our community. So in many ways, through these stories of our patients, the different services that Kilimamo has offered in collaboration with the community, it's been a long road, and it's still a long road going, but I really appreciate all of the connections that were formed it's really a learning process for everyone. And I really appreciate the strengths that other community organizations have brought to help bring this vision to life and to help take care of our kupuna. And as a closing, just a photo of me with my kupuna when they were still alive. And this is when I had chicken pox, a different communicable disease. And I kind of look at my time now as an opportunity to turn around and take care of, they're not here with us anymore, my kupuna, but take care of other kupuna in our communities with all of these experiences that I have. So mahalo for your time. Thank you so much.